Joining us in the studio this morning is Dr. Christine Pickup from Mount Harrison Audiology in Rupert. And she's going to be joining us on a monthly basis to talk with people about hearing health. We should point out, too, if you've got a question about your hearing health, she's the person to talk to. Bill Colley with you on News Radio 1310 KLIX and newsradio1310.com. First of all, welcome back.
Well, thank you. It's nice to be here.
The air quality probably slightly better in the building today than outside. We were having this conversation just quickly. You pointed out that some of these allergies, especially from the particulate and the smoke, can also have an impact on your hearing. It's not just necessarily what you'd feel in the nasal cavity or your throat.
That's true. Any kind of inflammation that happens in the throat it can also affect the eustachian tubes. That's basically how the ear breathes. It's a little tube that ventilates the middle ear space. So if you get irritation in your throat, a lot of times you'll get irritation up that tube and it will make your ears ache. It will make it feel like your ears are plugged because it's not ventilating properly. And it really, I've had a lot of patients come in this summer with all the smoke and the harvest and everything happening, having those types of symptoms.
It's a little bit like, when you're driving in the mountains and you feel that pressure in your ears, and I'm sure it has that same feeling sometimes.
Exactly, yeah. And that the pressure is because that tube doesn't open like it should. Pressure on the outside and inside can influence it. It also is inflammation in the ear that causes that tube to do the same thing, close off, and then you can't ventilate properly and your ear feels plugged and it's uncomfortable.
You wanted to talk a little bit today about the relationship between people's hearing and some cognitive loss they may have, and there's a pretty good relationship between the two.
It's a very strong link. So this September is World Alzheimer's Month, and it's a really good time to talk about these important topics. When you look at our global health concerns, in fact, just this last fall, the Lancet Commission in Europe identified several risk factors for people developing cognitive decline, dementia, and Alzheimer's, and things that we can do to help prevent or mediate that development. One of the key things they recognized was hearing loss is one of the most modifiable lifestyle risks that people have. And they kind of looked at the life cycle. One of them was early childhood education. Like if a person didn't get out of elementary school and go on to junior high and high school, that's a risk factor. But in midlife, so those of us in our 40s to 60s, hearing loss is the number one risk factor. And then right below that is diabetes and heart disease. And so what they were recommending is, getting your hearing checked at 40. And then if you do have some hearing loss, even mild, that greatly increases your risk for cognitive problems.
Is that just because you lose some human contact?
That's part of it. So a big part of what keeps us healthy is our social interaction. So absolutely, when you can't communicate well, then you have trouble. That puts you at a higher risk. But the other thing is what we have been terming cognitive load. So when you have hearing loss, it's literally like playing Wheel of Fortune. There's parts of the message that are missing and you have to fill in the gaps. And so the more cognitive processes you have to put towards decoding rather than understanding, that increases the cognitive load and makes it harder. We only have so much processing that the brain can do. And so if you have too much processing going towards figuring out what people are saying, you have less available to do other things.
I was going to say for someone who is probably older in the first place, they're going to be frequently checked for either or both hearing loss and perhaps some of that cognitive decline. And you're probably trained when they come into your office to recognize some of those other issues.
Yes, we are. And that's something when we go through a health history that we're checking. But unfortunately, I'm not seeing it happening on a regular basis. When people go to their primary care doctors, they're not always being checked for hearing loss, and they're not always being screened for cognitive issues. And so that's something that I really am hoping to bring a greater awareness to our area, that needs to be done on a regular basis for every patient.
Somebody who's having that hearing loss, would just being equipped with hearing aids, would that slow some of that cognitive decline?
That is what is being studied right now. So there have been a couple studies that came out of Europe that show that there's a relationship. If you treat the hearing loss, that the cognitive decline is greatly reduced, and people who don't treat their hearing loss decline very rapidly. but we can't say definitively, yes, hearing aids are going to stop dementia, but they definitely are a tool. And that's what the Lancet Commission was recommending is let's get this treated as soon as possible, and that will reduce your risk.
And on the opposite side of this, could uh, Alzheimer's or a move into dementia, could the what's going on in the brain then in turn affect hearing,
Yes.
which had been fine beforehand?
That is the other thing. So hearing is very, very complex. It's not just what comes in our ears, it's what the brain does with the sound. And there are some forms of Alzheimer's that affect those central processes, even before the peripheral damage or, hearing loss that's from noise or from disease, that kind of thing. There's kind of those two parts. And so when you are being seen by an audiologist, you want to make sure that they're doing some of those cognitive tests, that they're not just testing the tone test. That tone test is a very peripheral, low-level functioning test. Almost any, a 2-year-old can hear a tone and raise their hand, but an adult should be able to, perform much higher listening tasks, and so those higher performing tests should be done as well.
I can recall reading the story when the famed actress Rita Hayworth died. That was probably 25 years ago, but she had been in a nursing home since the 1950s because she had early onset dementia.
Right.
I've often wondered if that may have been related to something like a hearing loss that didn't go diagnosed when she was maybe 30, and then quickly helped accelerate this, and then unfortunately left her for 35, 40 years living in a home until her death.
It's hard to say because we don't have any evidence of, that's her own private medical thing. It's hard to say.
We didn't necessarily have the level of checkups because we didn't have all of this body of literature 50, 60, 70 years ago that we have today.
Absolutely not. And there is a difference. That early onset dementia, Alzheimer's, usually has a big genetic component built into it. So there are, and that type of dementia is a little bit different than the ones that we see that hit in later in life.
Now, those people who are born with deafness, are they at an increased because of just from day one, they don't have the hearing? Are they at an increased threat?
No, if they have early intervention. So people who have a complete deafness, I have one friend, her little boy was born without the right structures in his inner ear, and she liked to joke that he's deaf as a post, but he has cochlear implants, and he's had language intervention since they discovered his hearing loss. And that little boy is as sharp as a tack. Actually, he's not a little boy anymore. He's almost an adult, but he's doing fabulous. And as long as the key with kids is getting that language input as soon as possible, and whether they decide to use sign language or they decide to do cochlear implants and hearing aids, having that consistent input is what is so critical. So that is a different thing so the key with adults is it's that loss of function. So at one point things were normal, and then when things change, whether it's from noise exposure, all those other things that happen, that's the issue. It's having that input and then losing it. That's what triggers those changes in the brain.
A lot of these things, when we diagnose them, there's certain obviously ailments people have that we don't really check on until maybe they're 50 years old.
Right.
And so, but at some point, everyone has a hearing test when they're in school. I can recall those where
they should be.
You get the tone and you'd have to raise a finger on each side of where you heard the tone while you're having the hearing test.
And that was a screening. That wasn't an evaluation. So what they were doing is kind of, they get all the kids and do a quick test to see who needs more testing. And if you pass the screening, more than likely you're okay. But it doesn't go into full detail. So that's different than the baseline exam that we recommend that all adults have by the age of 40. When you have that baseline test at 40, then we can actually monitor for changes. We know exactly what your functioning is at that point. So for example, if you had a heart attack, or you had a terrible kidney infection, or you developed diabetes, we can actually monitor any changes that happen to your hearing due to those diseases.
Now walk us through what happens, because a lot of people come to your office on referrals, but some come directly.
Yes.
When they get there and this is their first time, they may have not even had anyone do a screening on them since they were in grade school.
Right.
What's the process?
Great question. So the first thing we do is go through their health history. and we go pretty in depth. I want to know what medications you're taking. I want to know um, any major illnesses you've had, any surgeries you've had. These are all things that can influence your hearing. So we get a really good picture of what your health is like before you ever stop, once you step in the office. And then we begin the process of how are each of these different parts of the ear. So we start with the outer ear, we look in the ear canal, make sure there's no structural problems. Then we test the middle ear and we look for any problems with the eardrum. There's three little tiny bones behind the eardrum. They're called the ossicles, and they are amazing. And if they're not working, that will cause a hearing loss. So we check the ossicles. The first cognitive test we do is what's called acoustic reflex testing, and this is kind of a neat thing. We all have a built-in protection for our hearing. There's a teeny little muscle. It's about a quarter-inch long that pulls if there's a loud sound. So it's our built-in hearing protection. It holds those ossicles tight so they don't transmit the sound as well. And we can check that and see the sound actually goes up to the brain and then goes down to the other muscle, and we can tell right from there. We can estimate hearing loss just based on that test. But then we tuck people in the booth and we check tones as a beginning. But then we also do a lot of speech testing, and that's where we really get into the cognitive stuff. How well are you hearing in quiet? How well are you hearing soft words in noise? And my favorite test to give people is the quick speech in noise, because that really tells me how they're functioning on a very real world kind of, but structured so that we can score it.
I also had sent you a link a couple of weeks ago about a woman who was having this terrible, almost ringing in her head.
Yes.
And I think that it took 2 years for her to get it diagnosed.
Which just makes me sick to my stomach.
Because it turned out she just had a broken bone.
She did. One of the little ossicles was fractured, and that was what was causing all of her symptoms. And once she got the correct treatment, in her case, she was one of the small 6% of people that actually has a hearing loss that can be medically treated. It fixed her problem. But the sad thing to me is that she had to go all that time misdiagnosed. That's something that the first place she went to, they should have been able to catch that. That was what's called a conductive hearing loss, and that should have been caught that first visit.
Was that through surgery?
Yes, they repaired it through surgery. The surgeon actually went in and glued the bone back together with special glue, and so that repaired the damage and put it all back together.
It's a microscopic surgery.
Almost, yes. It's very, very small.
I was going to say there's not a lot of room for error when you're doing something like that.
No, the ossicles, the three little bones, all fit on a dime. That's how small they are. They're the smallest formed bones in the body.
Well, we should point out then for people who are tuning in that there could be any number of causes for hearing loss or ringing in the ears or anything
Yes.
you have going on.
Yes.
But the fact of the matter is, if they don't go to someone who knows what they're doing, they may not figure this out for a long time.
Exactly. And that's one of the big differences between coming to our office versus going to, just a place that sells hearing aids. Those offices do a great job, but their purpose is to sell you a hearing aid. And a lot of the technicians that they have working there, their purview is only to do a hearing test sufficient to sell you a hearing aid, not to diagnose what's the problem is, because there are, it's not a lot, about 6 to 8% of people who have hearing loss have a medically treatable condition.
We've got a short break. Dr. Christine Pickup from Mount Harrison Audiology in studio with us until 9:30 this morning. We're at 51. 52 now on Magic Valley this morning with Bill Colley on News Radio 1310, KLIX, and newsradio1310.com. It reminds me of those people who try to sell you all sorts of snoring remedies online.
Yes.
I wouldn't recommend that.
No.
Dr. Christine Pickup joining us in the studio. It's 9:23. We're at 53 on Magic Valley this morning on News Radio 1310, KLIX, and newsradio1310.com. The doctor joining us from Mount Harrison Audiology in Rupert. Bill Colley with you as well. And a telephone number if you'd like to reach the doctor, 208-736-0300, 208-736-0300. For people who'd like to know a little bit more about your office and your location, we might want to remind them again. Very easily found in Rupert.
Yes, we are just north of the hospital. So if you can get yourself to Minute Oak Memorial Hospital in Rupert,
Which is big,
and that's easy to find on Google. Our office is in the medical plaza just north of the hospital. The ER office is just on the north side of the hospital, and we're just across the parking lot, second office on the left. Then you can also go online and learn about us. Our website is mountharrisonaudiology.com. And I haven't gotten to tell you this, but we've actually brought on a second or a third doctor now. So,
Really?
yes,
Wow, you're growing by leaps and bounds.
we are. And it was getting to the point where I was so busy myself, and I still have 4 kids at home. I still needed, they need their mom. And so it was time to step back a little bit and ask for some more help. So we're really pleased to announce that Dr. Shane Hunsaker has joined our practice.
Well, now you think about this for a moment, though, too. I think people admit we have a lot of people who come here to retire because I just read today where Idaho is the 6th happiest state in the country. They're coming here because, there's a lot of amenities you may not get other places and it's affordable.
Mm-hmm.
But a lot of older people are suffering from issues like hearing loss.
Yes.
And there's a constant need for what you're doing.
And it's growing as more people learn about what we do and why we're different. We're really busy, which is a wonderful thing. That means more people we're taking care of and more people that are getting the help that they need.
Right. Walking out the door and they're hearing better.
Exactly.
We were talking off air about people who are buying these online hearing aids and how really they could be doing themselves some serious harm.
They could be. If for example, if you buy used hearing aids on eBay, you don't know who they were set for. A hearing aid is a very precise medical instrument that needs to be. It's not like glasses. There's not a specific prescription. We don't do the hearing test and then automatically know how we need to fit the hearing aids. It's a very individual thing. They need to be verified with speech mapping or another kind of real ear. It's a little microphone we tuck in the ear with the hearing aid. So they're very specific for each individual patient. And so if you happen to buy hearing aids online that were set for someone with a very severe loss and you have a mild loss, you'll actually cause more hearing loss wearing those.
Yeah, it's like somebody wearing somebody else's glasses. I mean, they're different prescriptions, and just saying, "Well, can I borrow yours for the day?" probably isn't the best approach to take with that.
No, it's not. And it doesn't have to be expensive to be a really great way to take care of your hearing, but it has to, the best results happen when you are in the office and you're being, taken care of in person. That's how we get the best results.
But why would anybody in the beginning even think about using somebody else's, a previously used hearing aid?
Well, I think some people don't understand that hearing aids are not like a cell phone or, any other
Sure.
kind of, a lot of them, people think that a hearing aid is a commodity or a hearing aid is, something electronic that you can just go buy and use off the shelf. And that's not how our hearing works. Our hearing is so complex. It's not just what the ear hears, it's how it's traveling up to the brain, what the brain's doing with the sound, and all of that needs to be taken into account.
Yeah, because in the old days, people would have those big horns they'd hold up to their ears in order to try to amplify the sound going
Mm-hmm.
in, which I assume probably weren't the healthiest thing to use as well.
Well, it was better than nothing at the time, but modern hearing aids, I actually try to get away from that term. What we use is neurotechnology. These are devices that are very precisely designed to not just make things louder, but to make it sound more clear and to protect your hearing at the same time.
And insurance is going to help out for most people, right? Because the technology is so great that, I mean, you're not buying these for $50, $100.
No, but unfortunately, most insurances don't cover. If you are a patient that has Medicare, unless you have a supplement plan, Medicare doesn't cover eyes, ears, or teeth, which is unfortunate, but that is how things are right now. And most other insurances are the same way. There is a group right now that is working very hard to get hearing aid coverage in Idaho for children because that's critical. We've got lots of little kids running around in this state with hearing loss that need to be treated. It's a critical time for their brains to develop, and we need to get that sound to them as best we can. So it's something we're working towards, but it is something that's very difficult, and why we offer, payment plans and why we do everything we can in our office to make it affordable.
I guess, and depending on who you ask, I'm a senior citizen because I'll be 56 in a few weeks. But I would think that those are the things as you get older. Eyes, teeth, and ears are the things you're probably most concerned about.
Yes, and yet Medicare doesn't cover. They'll cover the diagnostics, but they won't cover the treatment.
So it could be a lot out of pocket for somebody.
It could be, which is why we are really careful about that. We are very cognizant of what kind of burdens we're working with. We work with programs that help people get hearing aids that if they that qualify for them. We have in-office financing. We have different things we do to make sure that nobody leaves without help that needs it.
We got about 30 seconds to go. A lot of people are now using these programs where the churches are essentially crowdfunding healthcare.
Yes.
Something like that could work here.
Oh, absolutely. And we're happy to work with those.
And so generally, if somebody had, they had to pick up the tab of a few $1,000s, that just might be the way to go with all of this.
There are state programs we work with. There are private foundations we work with. Nobody should leave our office without help.
I want to thank you for coming by today. I'm trying to do the math in my head because I know we'll see you probably in October.
The second Monday of each month.
Speaking of being 56, that'll be right in that neighborhood. So thank you again
You're welcome.
for coming by. Todd Starnes is on the way in just a couple of minutes on Magic Valley This Morning on KLIX.